question of is it a toothache or is it sinus pain is a question that we face relatively commonly in the clinic, and usually at certain times of the year. If there's changes in the weather, there may be some pollen in the air, often patients can come in and they will swear black and blue that they've got a toothache. Now, I like to refer to sinus pain of the maxillary sinus in this case as the best type of toothache that you can get, because it isn't even a toothache. So where is this sinus? Most people know about their maxillary sinus if they've ever gone for a surf or gone for a swim and leant over afterwards and found that their nose drips. And it's not the same as being in the bath and getting water up your nose and spluttering to get it out. It's water that you think, where is that coming from? Well, that's coming from your maxillary sinus. So it's an air space in behind your cheeks, and usually this sinus space is very, very close to the roots of the upper back teeth. Now, if you've got inflammation in your sinus, so that the lining of the sinus is inflamed, it gets bigger, it causes pressure, it squeezes on any nerves that run through it, it can genuinely feel like a toothache. Now, if you go to your dentist and you're complaining of a toothache, the first thing that they're going to do is check the teeth, make sure that they're responding normally. They're going to take an x-ray and try to eliminate a dental cause. So what they're looking for is decay, a crack, a wear facet, a chip, an infection, any problem that is associated with the tooth that could be contributing to that toothache. If they can't find something, then they start to look further afield. So we'll be considering whether or not the sinus could have any impact. So some of the symptoms of maxillary sinusitis are a dull pain on biting. You might have increased tooth sensitivity. It could be aching all the time, and often it's aching worse when you're lying down. So sometimes it is associated with having a cold or the flu, but it isn't always. And how we treat maxillary sinusitis does depend on what's actually caused it. So commonly it's caused by inflammation as a result of an allergy. So pollen is in the air, you're allergic to some dust or something around your environment. If that's the case, it can be treated with antihistamines prescribed or recommended by your GP. It can also be associated with a bacterial infection, in which case antibiotics will work. Often though, taking a drug or medication is not always the best thing. Most sinusitis will resolve with time, and you can help it along its path using steam inhalation or eucalyptus inhalation. And if you're in a lot of pain, it can be relieved by Panadol or ibuprofen, as long as you're not allergic. So the good news is that most instances of maxillary sinusitis will resolve within a week or two, but it is important that if the problem is persisting, that you consult your dentist or your GP to follow up.